Good afternoon to, there we go. Good afternoon to some, good morning to others, and of course, welcome to all. My name is Kevin Blyer. I am a grateful volunteer for the New York City chapter of the Alzheimer's Association. And, as someone who has cared for someone who has confronted dementia, my mother, this session is, of course, particularly meaningful to me. And I am, of course, grateful for the work our guest, our expert, Sarah Gorenstein, does every day as a certified dementia care partner. And, of course, the opportunity to welcome you all to today's Ask the Expert program. As you may know, or you may not know, happy to tell you that the Alzheimer's Association works on both national and local levels to ensure care and support for all those affected by Alzheimer's and other dementias, largely through the association's 6 core programs. Those 6 are care consultation, consumer education programs, early state engagement programs, information and referral services, and support groups. And of course, as part of that, the New York City chapter offers educational programs on a wide range of topics. But to address questions and topics beyond those covered in our standard offerings, the New York City chapter has launched this series, Ask the Expert, which are, of course, free virtual education programs featuring external experts addressing subjects of particular interest and, of course, their expertise. I am not that expert, but before introducing today's expert, Sarah Gorenstein, I can share some basic information and an overview of resources to make sure you know where you can turn for support. And in addition, during the next hour, you will see that Roni Kersey, the care consultant with the New York City chapter, will be managing the chat. And after the presentation, she will moderate the Q&A portion of today's program. Okay, Cody, next slide. First of all, and this won't surprise many of you on this call, but dementia, as we know, is a profound disease. Its scope, its prevalence, more than 6 million Americans have been diagnosed with Alzheimer's, and the totals with Alzheimer's or another form of dementia are even higher, quite higher. Next slide, if you would. What that means is that over 11 million Americans provide unpaid care for those people with Alzheimer's or other dementias. And, the numbers are staggering. These caregivers provide more than 16 billion hours of their time, valued at over $271 billion. And of course, for caregivers, the cost to any one person is what can become truly debilitating, and why the work that Sarah does can be so helpful at a very difficult time in someone's life. Next slide. And that's, of course, much of what we'll discuss today, the impact of Alzheimer's on loved ones. We can certainly understand that caring for someone living with Alzheimer's or another form of dementia can take a physical, emotional, social, and financial toll, on families and friends. It certainly did for me, for my father and our family. We take some solace, or at least not so cold comfort, in the knowledge that we're not alone. Not only in that 83% of the help provided to older adults in the United States comes from family members, friends, or other unpaid caregivers. And there's that number again, $271 billion worth of unpaid care, truly staggering. And it often falls disproportionately on women. Approximately 2/3 of caregivers are women, and more specifically, over 1/3 of dementia caregivers are daughters. All told, of the total lifetime cost of caring for someone with dementia, 70% is borne by families, either through out-of-pocket health and long-term care expenses or from the value of unpaid care. And additionally, we at the Alzheimer's Association recognize that not everyone living with dementia has friends or family members who are available to provide the support they need. And that's where the Alzheimer's Association can step in. So it's no surprise that dementia is particularly debilitating. Specifically, compared with caregivers of people without dementia, twice as many caregivers of those with dementia struggle with these substantial emotional, financial, and physical difficulties. And as I said, the Alzheimer's Association is here to help. Next slide, which leads us to our mission. The Alzheimer's Association leads the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. And, as I mentioned earlier, I have seen that mission in action firsthand. Finally, Next slide is fine. Next, before I introduce Sarah, we want to make sure that everyone on this call knows about the ways all the Alzheimer's Association can be helpful to help you, and so that you can spread the word. No matter where you are on your journey, you're not alone. There is, first of all, that number that we all have memorized, 1-800-272-3900. It's our 24/7 helpline. It's available around the clock, 365 days a year, and it's a free service. It'll connect you with specialists and, even better, master's level clinicians for confidential support for all people living with dementia, caregivers, families, and the public generally. And when in doubt, the place to go for all of your answers is alz.org, alz.org, specifically in New York City at alz.org/NYC. That's where you'll find local programs, services, and support groups, and connect you with resources in your community in real life, or as the kids say, in IRL. IRL. They don't say in IRL. They just say IRL because they're hip. And it's also there that you can connect with the Community Resource Finder, which is, of course, at alz.org/CRF. It's a full database of local dementia resources. Okay, so now let's get started with the real expert of the hour and today's special Ask the Expert program, namely building your support team. And to lead us in that discussion, Sarah Gorenstein is a certified dementia care partner and a knowledgeable geriatric care manager with hands-on experience managing bespoke care ecosystems for families. She is passionate about building effective multidisciplinary teams through strong culture and is on a mission with Lizzie Care, which you'll hear all about, to deliver the best possible care to seniors and their families through curated systems of dedicated and specialist caregivers supported by expert health guidance, supervision, and a unique digital platform. See, I told you, she is the expert to ask on this Ask the Expert session. And might I add, please feel free during this hour to type any questions you have into the chat box. We will address them during our question and answer period at the end of the presentation. So with that, please, Sarah, the floor is, of course, yours.
Well, thank you so much, Kevin. It is great to see so many of you here this lovely, wet lunchtime in New York City. Don't be fooled by my accent. I am here live on the East Coast. I moved over here about 20 years ago. I laughingly refer to myself as a mail order bride. I met my husband and moved, so that's why I'm here. But I really appreciate you all showing up. So Kevin's given us a very good overview of the state of the nation as far as Alzheimer's and care goes. Personally, I'm affected by Alzheimer's. It runs in my family right now. My father has it, and I am helping him as much as I can and my mother while living on another coast, on another continent. So while I do this for a living, I also have a lot of lived experience, and I want to just share what I've learned along the way and see how we can help you build your team. So first thing I want to say is we all need someone to lean on. You'll see a bit of a theme with my slides as we go through this presentation. Songs, music is something we are all quite aware is ever present with a person living with dementia. So I thought in order to kind of bring home my message, I would theme it with that music of the day. So we all need somebody to lean on. It couldn't be more of a truism for somebody with dementia. We all know that dementia is a progressive disease. If you're starting out on this journey, or if you're helping out with somebody else's journey, with someone else's disease, now is the time. Empower yourself. Think about what is going to be coming and how you can build that support team to help you along this journey. You're not alone. You're not alone. And that's something I can't reiterate more. There is help in places that you might not even have thought of. There are the obvious places. We will go through that a little bit later. But know that you're not on your own. and that everybody wants you to have the best. Everybody wants the best experience for you. And nobody is going to know what that experience is, what your personal experience and your personal choices are, unless you tell them. So you know what you want, you're not afraid to tell it. And don't forget, it does take a village. We're not talking about your immediate family. We're talking about thinking about who is going to be on my team. So with the people that I work with in my geriatric care management practice, aka Lizzie Care, we talk about all of our patients in terms of their care circles or their teams. And we refer to them as Team Sarah. Who's on Team Sarah? So that's the kind of creation. That's what you should be thinking about creating. That's a really good place to start. Who is on my team? These people are going to be standing by you. So stand by you. Who do I want? Who do I need on my journey? As I said, the really the obvious people that will come to mind are your close and extended family. They're probably not the only people you want on this journey. I think there's a lot of guilt around burden within families, and people do want to help, but it's not a bad idea to think about who you can rely on beyond your spouse, your children. They may be far away, they may not be around, you may be on your own. So I'm trying to cover all of these situations. There is no one situation, there is no one journey. That is something we are very aware of. Everybody has access to very different resources and very different family systems. So what I'm trying to do here is help you understand that there are people to help, and just to give you some ideas about who those people could be and who you can tap into. So beyond your family, I refer to a group of people called your family. This is something you may be familiar with, but many of us have friends that we have had along the way who we really consider family at this point. These are really amazing resources for you as you go through this journey. With family, your relationship is your relationship. It's there because you want to have that relationship. And you'll also find that these are people who really want to step up for you as well. What they need to do, what they need though, is they need some direction on how to step up. They may offer help. They may say, what can I do? When they ask you, what can I do? That means they want to know, what can I do? Don't be shy. Tell them, oh, I know you make really good pot roasts. Would you mind making that for me once a week? Oh, I know you love talking on the phone. Would you mind calling me every day? These are all the things to be thinking about. So beyond your family as well, there are your neighbors. Have you lived in the same apartment building for a long time? Does your doorman know you really well? Would they notice? Would they be there? Would they be interested? Do you know that they could give you a little helping hand? I'm sure if you asked them, they wouldn't mind. Communities, faith communities, you don't have to be the person who goes every week. Faith communities can be an incredible resource for you. They often have volunteers associations, and they want to help. A lot of the clergy are actually trained in pastoral care and will give you either somebody to speak to or somebody to help you. So keep that in mind. And then finally, trusted professionals. I'm talking about medical professionals, I'm talking about attorneys, I'm talking about accountants. The more that you can get planned and the more that you can think about these things ahead of the game, the better place you're going to be as you travel through the disease. My advice to you is, if not now, when? There is no time like the present. Don't be scared. Don't be afraid. Don't feel ashamed. Don't feel embarrassed. I think you'll be surprised if you just tap in and understand how many people really want to help. I'm a firm believer in people are good. And I think when my experience of going through this with my father has been the shopkeepers near him, they keep an eye out. They want to make sure he's safe. So tap into that. It can be stressful. What we're looking to do is relieve as much stress as possible for your daily life. So my first advice to you would be get your medications in order. You may have other conditions that you're managing. You may be taking tablets for Alzheimer's. You may be taking tablets for all sorts of different conditions. It sometimes can be hard to keep track of that. It's hard for everybody, but it can be particularly hard when you're dealing with memory loss. It's also hard to ask other people to do that for you, particularly if you're living alone. So my recommendation would be to speak with your doctor, speak with your pharmacy, and I have a little show and tell here for you. Um, some of you may be aware of this, some of you may not, but you can actually have your medications built into something like this. So this is a very simple one. This is for 1 tablet a day. The days of the month are on here. The name of the medication is on here, but you can have much more complex regimens where you have tablets being taken 3 days a week, 3 times a day, every day, and they'll come in a weekly pack like this. What that allows you to do is it's a visual. Did I take my tablets today? Or if somebody is coming in and they say, did you take your tablets? They can take a quick look. Oh, he missed the tablets this morning. Let's just make sure he gets those taken. So medication regimens can sometimes feel a bit onerous. So that's one simple way to do it. And even CVS are doing that now. And I can give advice on that if you don't think your pharmacy will do that. The other thing is for medications is set yourself a reminder. I'm going to be coming back to this little device later. This is an Alexa Echo. They're very, very reasonably priced. I think sometimes $20, $30. And if you have an Amazon account, you can link it and you can set yourself reminders. It's like a little bit more of a sophisticated alarm clock. And there's unlimited numbers of reminders that you can set for yourself. And you can even set a different reminder for a different tablet or if there's music that you really like, you can set it to music. So lots of ways to make it a little bit less stressful for you. Grocery deliveries. We all need to eat. And sometimes it can be quite hard to get out to the store, especially in this miserable January New York weather. Make it easy on yourself. Take the burden off yourself. Nowadays, most grocery stores will deliver online. It's very simple to set up a delivery slot. Even something you can do on a regular basis. So if you know you're going to be home on Friday morning between 10 and 12, you can get it set up. You will probably need someone to help you set that up, but once it's set up, you just plug and play and it'll happen every week. I'm going to skip the socialization and talk a little bit about auto payments because that's a very similar thing. We all have to pay our rent every month. We all have to pay our electricity every month. And it's difficult sometimes. We may forget. And it's also going to the bank, going to mail your check off. Again, make it easy on yourself. Set up an auto payment. Very easy to set up. Your bank can help you with that. And you can also check and make sure that that's working. So you'll never be thinking, oh my gosh, I forgot to pay that bill. Does that mean my telephone's going to be cut off? You just want to automate all of the activities, all of the things that you have to do on a monthly basis, and not to have to think about it again. Plug and play, set it up. Let me just go back to socialization. Socialization is key to keeping a good, happy, upbeat attitude. If you can't see your friends, there are ways to do it virtually. We'll talk about that in a little bit. But keep connected with as many people as you can. Keep going with it. And if somebody calls you, you don't want to see them that day, that's okay. But make a plan to see them another day. If you go to your church every week, but you find it a bit difficult, reach out to them. Say, I can't make it there this week, but I still want to be involved. How can I do that? Just keep those connections. Don't isolate yourself as much as you can. So the times, they are changing. You see my theme here? I think you're picking up on this song thing. Um, Technology. We talked a little bit about Alexa just earlier. Um, when I talk about technology, I'm not just talking about the latest and the greatest. I'm talking about the old as well. I'm going to let you into one of my little secrets, two of my little secrets on here, my particular secrets. My first one is whiteboards. Everybody should have a whiteboard in their room, in their house. This is my whiteboard. It is a sticky post-it note. It's made by the post-it note people. So I can, if I don't like it in my bedroom, I can move it into my living room. It helps me keep track of what's going on a daily basis. I have two teenage boys, one who is in theatre and one who plays sports, and I can never remember who's coming home at what time and who needs picking up where. I put up the board. Everybody can read it in the morning. Oh, that's what's happening today. My husband and I sometimes work from home. We sometimes work in an office. It's so helpful. And if you're working with someone with dementia, it really helps them retain a little bit of agency on remembering what they're supposed to do and where they're supposed to be. And it stops them from asking you. And you can say, go have a look. Remember, we wrote it down. And it's a visual cue. We call these visual cues. Very, very useful. And the reason I recommend the whiteboard is because once you've done something, you can, I'm going to use my finger here. I don't recommend to do this at home, use a cloth, but you can just scrub it out with, you use one of these semi-permanent pens and you write up what you're going to be doing tomorrow. Because we don't really care what happened yesterday. Let's think about what happens next. So so the whiteboard is everything. Very, very useful. And then a large clock, again, with the date and time, is very, very useful for situating people who have dementia. Again, it gives them a little bit of agency. They don't have to keep asking. They can just look because the disorientation is real. And anything we can do to help minimize any anxiety really helps. Okay. The next piece of tech I'm going to show you, again, is something, this is my other favorite. This is the Apple tag. I have it on my car keys because I lose my car keys all the time. The Apple tag is a very small, discreet little button. It works, of course, with Apple technology. I think there are other products on the market that work with Android. When you put it on your set of keys, you take your keys with you. So if you have a loved one who has dementia and is still able to go out, still mobile, and is still you're wanting to retain as much independence as possible, you know they're going out, you're expecting them back in half an hour, they're not back, without having to bother them, you can just track it on your phone. That tag can go on your phone. There's an app on your phone. This sounds complicated, but I promise it's not. I have this set up with my father as well. And you can see where they've gone. So if they're, oh, I can see he's still in the post office. Or, oh, I can see he's walked somewhere that he shouldn't be. I need to go and find him and I need to go and see what's going on. So it's just a little, it's a little bit of helicopter parenting for people with Alzheimer's. And it's something that can just give you a bit of peace of mind if you're the primary caregiver. And as I say, you want to retain as much agency and independence as possible, but you also want to know where they are. They may not remember to take the telephone with them, but if you just pop you can even put the tag in a pocket in a coat if they're not going to take keys. So just things to think about there. For prevention, I think that's something that we're all trying to mitigate all the time. Unfortunately, with Alzheimer's, with dementia, mobility is one of the pieces that will go, because the connections are not there to be as mobile as possible. But that can take a really long time. And again, we're all about encouraging agency, and we're all about encouraging people to remain by themselves for as long as possible. So if you are helping to take care of somebody who is living by themselves, and you know they have dementia, but they are not at a stage where you feel it's time for them to be moving, and they don't need caregiving, but you're just a little concerned. There are all sorts of products on the market. Again, I can give more recommendations on this privately. One of the really great things is, we know that people with dementia often will get out of bed at night for a number of reasons. It's called roaming. If you're not in the same room, if you're somewhere else in the house, or if you're remote, if you're not living with them, you can buy pads that go on the floor that can hide under the rug. So if they're getting out of bed, it will trigger an alert on your phone, and you know something's going on, and you can give them a call and you can check in. So all of these items can really help somebody, I think, remain as independent as possible for as long as possible. Video cameras and FaceTime, as I referred to earlier, that can be an extended part of the socialization. If you don't live nearby, you can still stay connected. That's a great way to stay connected. And there are different techniques to being able to facilitate that for the person living with dementia. You can have somebody help them. You can write out instructions about how to, because sequencing is important for somebody with dementia. Write out the steps on your whiteboard. This is how you answer the phone. Another technique. Okay. As I've referred to before, there may come a point in your journey where you decide that living alone is not going to be an option anymore. You really need to think about what you want to see happen in your future. Should I stay or should I go? Do I bring help into the home? Do I go to an assisted living? Do I go to live with family? I don't have family. What are my options? Who can help me make this decision? Where do I go? Who am I on my own? We have the amazing Alzheimer's Association who you can turn to, who will also give you advice. But think about as well other places. Your PCP, your neurologist who gave you a diagnosis. The medical practices all have social workers, and part of their remit is to help you make these decisions. That might be enough. You might need a little bit more guidance. You might need somebody who brings it all together and who can talk with you as a family unit as well. This may not be one person's decision. This may be everybody coming together and deciding this is how we want things to unfold. And let's all be on the same page, and let's all remember we're all on Team Sarah, for example, Team Lizzie. There's a real benefit to having a third party involved in that who is not emotionally involved. So seek us out. And again, faith communities. Again, depending on your connectivity within that faith, and your belief system, they can be a real support system for you. So don't forget about that. Turn to them. This is talking a little bit more about who the professionals are who are involved in these decisions that you should be thinking about. Consult with a financial planner. Do you have the funds available to do what you want? If you don't, then what are your options? What's available to you? How is this going to work? Who's going to be paying for it? Are you eligible for state aid? What does that look like? How do you access that? How do you fill out the paperwork? Consult with a financial planner. If you haven't already done so, please reach out to a local lawyer. You need them for estate planning. You need them for advice on advanced directives. Think about future you for when you're not able to make decisions, and make those decisions now while you're able to. That helps relieve a little bit of the burden for your loved ones, and it allows for your choices to be honored. And that's really what we want. We want to be able to honor your choices as far as we can. And quite often these conversations go unsaid, and a loved one is left making a decision, which can be very, very difficult in a time of crisis. Try and approach it with more of a level head if possible, and just start having these conversations. Let them know what you want. Again, I refer back to faith. It can be such a source of comfort for people at this time, and it's available to you. There are many people who really care passionately about what's going to happen and how they can help you and want to help you. And again, doctors, I think we're living, unfortunately, in an age where many of us don't have the close relationships we had with doctors in the past. But if you are fortunate enough to do that, to have that, or you trust your doctor, use them, lean on them, go back to them and ask them what they know, because they're going to be very connected to your locality as well. And they may know of programs, they may know of resources that are available to you. And I think what I'm trying to reiterate here is there are many resources of different types and kinds here that can all be part of your team and building that support team, depending on where you are within your journey. I go here again, I'm talking a little bit more about the further resources. So the wonderful Alzheimer's Association, which clearly you're all taking advantage of and plugging into, they really are a fantastic resource. They can also help you a little bit with state and local resources, and some of the geriatric care managers and my own company, we can help you connect with those state and local resources as well. And I'm going to talk a little bit about what we do at Lizzie Care and how we're different to a geriatric care manager, just to finish off the presentation, and then we will go into some questions and answers. So at Lizzie Care, we're a new model that brings together all the people, tools, and resources to ease your dementia care journey. So we can help with identifying caregivers. If you're deciding to bring in professional caregivers, we can help identify the right ones and manage that relationship for you. And we work as a coaching. We have coaches who help guide you through your situation and with you every step of the way. We can even bring in medical care as and when it's needed, bring it to the home. And we can also help you make the decision on whether you want to stay at home and age in place, or whether you want to move into a facility, and what are the right facilities. And we do all this at a very reasonable price point. And we connect all of the stakeholders involved in your team via a digital platform. So everybody has visibility of what's going on. So if you have family who are distant or friends who are distant and you feel like you want them to be part of the conversation, then that's a possibility with us. I hope that's given you some food for thought, and I look forward to hearing some questions.
Thank you so much, Sarah. If you want to stop sharing your screen, we will open it up. This is your opportunity to ask questions of our expert, and Lizzie is quite the expert. When we were planning for this, I learned something I didn't know. She told me about those prescription, like sort of blister packs you can get, where they'll group 3 or 4 different medications that you take at the same time into one pack. I did not know that existed. So she's a wealth of all kinds of practical information, and Yeah, so Randy says yes, she was interested in those blister packs. So
Yeah, so even CVS, if you have your prescription with CVS, you can reach out to, and a lot of the local pharmacies, just give them a call and see if they provide that as an option. I think most do now, and it's usually covered by insurance. It's not at any extra cost, and it kind of replaces the more old fashioned like
Right.
pill boxes, which you have to fill, right? And if you haven't got anybody to fill those, that becomes a problem. So this is
Forgive me, I didn't notice. Did the blister packs actually have the time, like the days of the week on them, or is it just
well,
you? Yep.
this one is a very simple prescription for one pill a day every
I
day
see.
for
I
a
see.
month. But yes, they will split it into. You can get them by the week, and they will split it into
Yeah.
morning, lunchtime, and evening.
I didn't know that either. Fascinating. Okay, good to
Because
know.
quite often the medications, they interact with each other, and you have to be careful about
Sure.
taking them.
Sure. Yeah, I remember spending many hours organizing them with, and drawing with Sharpies about, but to know that that's at least something you can implement as well is great to know.
Yeah, and it's a really good visual for everybody involved in the care to know whether or not, because in New York, for example, if you are hiring in help, um, a lot of them are not allowed to administer medication. But what they are allowed to do is to see, did you take your medication and
Right.
prompt you to take your
Perfect.
medication. So it keeps everybody really on point.
Mm-hmm.
So I know that was a lot of wonderful information. I think that Sarah, you gave us a really good sort of breadth, right? This of things that are available, a lot of great idea starters. We have 20 minutes left. This is your opportunity now to pick Sarah's brain about your situation or drill a little deeper into some of the things that she
Yes,
asked, or ask a question about something she didn't address. So you
yes,
either raise your hand or you can type your question into the chat, whichever way you prefer. Did I
yes,
hear somebody? Michelle.
yes,
Yeah.
yes. Hi, thank you all for providing this. A lot of great information. And what I find is I always like to attend these things because it provides either reinforcement or there's always something new or different perspective or angle in which to use something.
Mhm.
So, the other thing I like, Sarah, is I saw something where it's like a blister pack you can purchase and you can put a sample of each medication so somebody can see what each pill looks like. It almost looks like a blister pack too, but you can put it in yourself. And
Oh,
I saw it on Amazon. I bought one. I still haven't used it, but this way it can be there. Either doctors can see it, or if somebody's coming to help, they can see to make sure that what the medication looks like. You can write the
A
name of it
visual
and have a
match, in
sample code.
fact.
Yes, yes,
That's
that's
yes,
it.
great. Yeah,
yes,
because I think it's so easy to trip up with the medications,
yeah.
especially there are many people are taking many different medications for many different conditions, and it's so easy to miss one or to take two instead of one. So it's really important that we have all of these aids and cues. I'd love to, if you get a chance, please send that to me. It's sarah@highlizzie.com.
Okay, sure will.
Thank you so much.
You're welcome. And the other thing is, what I would like to talk about. I'm working on building my network, and I guess I've been focused on certain people, and now I'm allowing myself to branch out and to think of other people. And so, um, but what I've noticed is there's some people I've been trying to come along for a long time, and they are starting to come on board. But this is what I'm finding: a situation where it's difficult for some of these people to understand they need to come and practice first before they are with my mom. You know what I mean? Because what non-caregivers don't realize, caregivers make 1,000 decisions every hour almost. um, and it's sometimes that we make the decisions based off of the energy and the way the person is looking that day or how they're feeling. And so we have to be able to adjust, and it becomes innate for us. And somebody new might not necessarily have that. So what do you recommend as the language in terms of for those people who are reluctant to understand that you're not, that I'm not just being overbearing or controlling, that you really have to come in and practice and learn before you can help in some cases? That's the first question.
Yeah, are you talking about friends and family, or are you talking about
Yes, friends
friends
and
and family?
family.
Oh,
Yes.
yeah. Yeah. I think with them, I think you just have to, I would recommend them coming and trying it out with you.
Mm-hmm. Mm-hmm.
Why don't you come and see how we do things?
Mm-hmm.
And I think that's an opportunity for you to really show them, show them exactly how you want things done without it being rude or forceful.
Mm-hmm.
But explaining, this is what keeps my mum happy and keeps her safe,
Mm-hmm.
and use that
Mm-hmm.
kind of language.
Yeah.
So that would be my advice there.
That's good. That's good. And then the second part of that question would be for some people who do come and help, and they're either reluctant to do that, to practice, or there's something that they are good at doing, but they just don't seem to want to consistently help in that way. Or I have concerns about their judgment. How can I steer them in a different way to help, or how can I guess push them out of the circle, so to
Well,
speak, because it's too stressful when they
yeah,
just, you know what I mean? Like,
I was
thank
going to
you.
say, if you're concerned about their judgment, I wouldn't pursue that,
Yeah.
honestly,
Mm-hmm.
because you have to trust your gut. I mean, a lot of this
Mm-hmm.
is, your mum and you know what's best for her. And if they, is there a different way they can help? Is there something else they can do that doesn't involve the activities that you're concerned about?
Mm-hmm.
I would think about it in those terms, and try and find other people to do the pieces that you're a little concerned, because you clearly have reservations, and you got to trust your gut with it.
Yeah. Thank you.
Sure. Thank you.
Thank you. I just also, before we have a question in the chat that I'll read. Before I do that, Michelle, I thought those questions were really good. And I just wanted to let everybody know that another resource, sometimes it's good to start with sort of a neutral sort of resource when you're trying to tell people how you want them to do things or how's the best way to do things. And so the Alzheimer's Association, we do have webinars, and we also have topic sheets that educate people on how to communicate with people at different stages of the disease as well, right? So that's something that you can tap us for. And sometimes that can be a more neutral starting point to have a conversation where somebody doesn't feel like they're being criticized, or, so just want to make sure that people know that that's a resource for you as well.
Yeah,
Excellent idea. Thank you.
I would reiterate that, Roni, with having a third party deliver some of this advice can be really, it takes a lot of the emotional heat out of it.
Yeah. Yeah, whether it's a Lizzie Care, or whether it's the Alzheimer's Association, or whether it's somebody else in your circle. Sometimes, yes, having a neutral third party saying these are recognized best practices, right? So now it's not you saying this is what I want you to do. It can kind of make it a little easier to then, and then you tailor it to exactly what you need for your person, right?
Right.
Whether it's you or someone you're caring for. So, okay, so we have a question in the chat, pivoting away from that wonderful question to our next question. Pauline says, thank you for the information you provided. I agree. I have to research and look into DNR, do not resuscitate, and DNI documents to file with my will. I also write in my journal my personal items, which I want to give others, and that needs to be completed while I'm still able to do this. And Pauline, I love that you said, while I'm still able to do this, because we really encourage people while they're in the early stages, do this ahead of time. So I'm not sure if there's a question there, or if you're looking for some resources, Pauline, to help you move along with that.
And Pauline, I'd just also like to add, I love that you're journaling. That is one of the best ways that you can help yourself. We work with coaches, and what they work directly with people in the early stages of the disease, and that is exactly what they teach them to do, is use that journaling, use the journaling, and it helps you connect dots and keep those dots connected for you. And I'm so happy to see that you know that already. That's great. That's one of the great best things you can do to help yourself at the moment.
Thank you. I really just have to, I already saw a lawyer and we did a new will, and I just have to research, and print out DNR and DNI because well, I won't like I still can. I just read this book. I don't know if anyone read it by Rick Phelps. He runs Memory People on Facebook,
Okay.
and there's the book While I Still Can. It was very good. And then also there's another book that he writes, Breaking Dementia, that like the font is easy to read because I have trouble reading now. So the font, I could actually keep up with the book because the font was just like great. And the
Amazing.
chapters were very short, only a page or two, and it was easier to read than a regular book. I can't do that anymore. So
Bravo. Bravo.
just to share if anyone wants to
Thank you.
read a
Yeah.
book
I
about it.
always I love getting these. I love getting recommendations on what to read. I thank you so much. I haven't heard of those.
Yeah, they were really, I read them both. They were very good. I enjoyed them.
Great.
Thank you, Colleen.
Thank you.
Thank you.
We have another question here in the chat from Jackie. I'm looking for more information on fall or panic alert devices since I don't live with my dad. What do you recommend?
Do you want to talk about what you have at the association, Ronnie? Because I know you have the alert program.
Yeah, that's more for wandering, actually. So we have a partnership program with Medic Alert that's called Safe Return that you can sign up for. And if you'd like information on that, I'm happy to send that to you. Jackie, if you wanted to put you should be able to put your email in the chat directly to me, Roni.
Okay.
If you'd like me to send you information on that after this, I'm happy to do that. But as far as the fall protection and all that, Sarah, I'll put that back to you.
Sure.
So
yeah,
fall and panic, she says.
fall and panic. Yeah, I think things have come on quite a long way since the first iterations of the necklaces that people used to wear. It's much more motion sensing technology that's being used. There are lamps that can be put into bedrooms that will pick up on motion during the night and that will actually light up. So I think best if you send me your email and I can send you information on that. I'm not kind of pushing any particular product, and it'd be interesting to see what the actual situation is, and if they're living by themselves or you don't live with your dad, right? So something that you'd probably be looking at, something that sends an alert to your phone, I would imagine.
Right. Because I mean, he lives with my mother, and she has some problems as well. But they have their cell phone, but I'm just not confident that if there's an emergency, they're going to pull that cell phone and call me. Like, I would much rather have something that they could just press and it rings my phone or it does something so that I can immediately like get on it.
Sure. So I'm going to put my email in the chat to everybody. And then if you wouldn't mind sending me an email, I will follow up with that for you.
Okay. Thank you very much.
Of course.
Wonderful.
I mean, I can tell you that for women, there's some really nice jewelry out there actually now, that you can wear as it looks like costume jewelry. and you can press it and it will send an alert to somebody. So if you
that's
want,
interesting.
yeah, so if you wanted to keep it, you know,
Right. Not that obvious. Right.
Yeah, discreet, or again, you know, injecting like an element of a little bit of fun and a little bit of pleasure into this, which I think I'm always keen to do, instead of making it so kind of medical. Let's make it a little bit more appealing. So I can send the information on that to you as well.
Okay, thank you very much.
Of course.
I'm looking for, if you have a question that you'd like to ask, you can type it in the chat, or if you raise your electronic hand. I can't see everybody on the screen, but I can see all the electronic hands. So if you know how to raise your electronic hand, if you want to ask a question, and we'll call on you. I'm not seeing any more right now, but Sarah, something I hear a lot when I talk with people. So for those of you who don't know, I'm a care consultant at the New York City chapter, and I oversee our early stage program. So I talk a lot with people in the early stage, as well as their care partners, as well as people in other stages. But one thing I hear a lot is, especially with people who are newly diagnosed, they're still figuring out how to do this themselves, and people want to help, and they come and say, I want to help, what can I do? And people say, I don't know, because I've never done this before myself, right? This is new to me. So I'm wondering, is there like a way to help people sort of evaluate how to take some of the things off of their plate, and put, what do you recommend in terms of, I'm just thinking about it myself. I'm a caregiver. I'm overwhelmed, or I'm a recently diagnosed person living and I'm overwhelmed. Somebody says, what do you need? I'm not sure yet. So do you have a suggestion of how to go about figuring that out?
Well, I think one of the things, I think you bring up a good point about caregivers, right? We talk a lot about the patient, about the person living with dementia. If you're a primary caregiver for that dementia patient, you're dealing with a lot in terms of managing someone else's disease, managing your reactions to that disease, and that can lead to something known as caregiver burnout, where it's the emotional, the physical, all of the I can't think of the right word, but everything involved in managing that person's care. So for somebody like that, I would say, think about a little bit of self-care, and think about taking a little bit of time for yourself, so that, like for any of us, you can't keep doing the same thing all the time and expecting to be at your best if you're not taking a break. So I think caregiving becomes one of those situations where you feel terribly guilty for not doing something, so you don't take that time out. So I think for a caregiver, it would be, think about what can you do for a couple of hours that takes you out of this situation. And then for somebody who is living with the disease, what is something that is particularly painful for you at the moment? Where are your pain points? What is causing you the most anxiety? I think it's all, relieve that anxiety. That's what you would like to do. Is it, oh my gosh, I don't know what I'm going to make for dinner tomorrow? If that's the case, then find the person who cooks really well and say, do you think you could do that for me? Or think about who the person is that's asking you, what can I do for you? What are they really good at? And what could they do that can take that task off of your everyday? What would really benefit you? That wouldn't be, you don't feel like it would be too much of an ask for them. You know that they'd enjoy doing it, so you're not going to feel bad about asking them. I think that's the way that I would approach.
I'm just sorry. I just wanted to say, I'm really sorry. I have to leave the meeting. I didn't want to just abruptly be rude. Thank you so, so much.
Oh, thank you.
And I hope to meet you all again soon. Thank you. It was wonderful. Thank you
so much. Thank you.
Thank you. Thank you. We do still have 3 minutes left before we end. So this is a chance, if you still have a question. If you think about a question afterwards, Sarah has put her email address into the chat. It's also Sarah at Hi Lizzie. That's HILIZZY.com.
Or as I would say, HILIZZY.com.
That's right. And then, you can also reach out to our 800 number as well anytime. If any questions that you think of, that's 800-272-3900.
Or rather, eight not.
That's right.
You're right. You're right.
That's right. And I do see that Michelle has her electronic hand raised. So go ahead, Michelle.
Thank you. And I do love that point that you made about being overwhelmed and just kind of having some things to figure out what to ask.
Mm-hmm.
And that's been one of the challenges for me, especially early on when visiting the doctor's office. They may say, well, we have things that we can help you too. And it took me a while until I finally said, oh, yeah, what can you help me with? And then they'd be like, well, where do you live? Oh, we don't have anything. You know what I mean? So it's like sometimes as caregivers, we just say okay and just go on, and then especially when we have those moments like that, we just don't bother to ask. So I'm I learned from I like to go to multiple support groups, and I learned from one of them to consider either having a written or mental list of things to ask for. And what I'm learning more is to verbalize a little bit more with friends and say, hey, yeah, it's great for you to research something and send it to me, but I need you to take it to the very elemental step, like that, to the point, like take it as far as you can. And then so that I only have like minimal steps to take, because it's a lot with everything we have to do. Then even if somebody gives you a link, you got to look into it. We just don't, and mind you, we're dealing with other things besides Alzheimer's. Oftentimes our loved ones have other conditions to manage as well. We have our own conditions, and some of us still have to work. So it's just hard to explain it to someone who's not in it. So I'm glad you brought up that point. Thank you.
Yeah. We recognize the importance of supporting the whole system, because that's the thing with Alzheimer's. It doesn't just affect one person; it affects everybody, in such a profound way.
Yeah. Sometimes the best way the person can help you with your parent or your spouse or whatever is to do your laundry. It's not necessarily direct, right? But just think about how great it is to have laundry off your plate. So,
and in New York, you can do that really easily as well. There are services that will come in. If you can pay for things in New York, you can get it done. So don't forget that.
Wow, there went our hour. Thank you so much, Sarah. I learned some things. Thank you, Kevin, so much for kicking us off. Thank you, everyone who came and participated. Again, you have our information if you have follow-up questions. And with that, we thank you.
Yeah,
thank you.
Thank you.
Onward. Thank you.